Difference between sleep paralysis and sleep bruxism. Because this picture shows that sleep paralysis, it is a condition where an individual upon falling asleep or waking up experiences temporary inability to move or speak, often accompanied by vivid hallucinations or feeling of pressure on the chest. Sleep bruxism, it is the invaluable grinding or clenching of teeth during sleep, which can lead to dental damage, jaw pain, and headaches. Difference between one definition: sleep paralysis, a temporary inability to move or speak while falling asleep or waking up, often accompanied by hallucination or a feeling of pressure on the chest. Sleep bruxism, the involuntary grinding or clenching of teeth during sleep, which can lead to dental damage and jaw discomfort. To occurrence, sleep paralysis occurring during transitions between sleep and wakefulness, either when falling asleep or waking up. Sleep bruxism occurring during sleep, often in stage of deep or REM sleep. Three symptoms. Sleep paralysis symptoms include an inability to move, difficulty breathing, and sometimes hallucinations or feeling of an oppressive presence. Sleep bruxism symptoms include teeth grinding, jaw clenching, tooth wear, and jaw pain or headache. Causes: sleep paralysis often associated with sleep deprivation, irregular sleep schedules, stress or certain sleep disorders. Sleep bruxism linked to stress, anxiety, sleep disorders, misaligned teeth, or other dental issues. 5 physical manifestations: sleep paralysis, no physical manifestation observed outside the body. Sleep bruxism, physical manifestations include worn down teeth, dental fractures, and jaw muscle soreness. 6. Diagnosis: sleep paralysis diagnosed based on patient history and reported episodes. Often investigation further if associated with other sleep disorders. Sleep bruxism diagnosed through dental examination, patient history, and sometimes with the use of dental guards or sleep studies. 7. Treatment: sleep paralysis treatment include improving sleep hygiene, managing stress, and In some cases, medication for associated sleep disorders. Sleep Bruxism treatment involves dental intervention like mouth guards, stress management, and addressing underlying causes such as misaligned teeth. 8. Impact on sleep. Sleep paralysis can disrupt sleep and cause anxiety or fear, affecting overall sleep quality. Sleep bruxism can lead to fragmented sleep due to teeth grating and discomfort, affecting sleep quality. 9. Prevalence. Sleep paralysis common in individuals with irregular sleep patterns, sleep disorders, or high stress. Sleep bruxism affects the significant portion of population with varying prevalence across age groups. 10. Associated conditions. Sleep paralysis often associated with narcolepsy, insomnia, or other sleep disorders. But sleep bruxism can be associated with temporomandibular joint disorders, TMJ, anxiety, and other stress related conditions. 11. Perception of episode. Sleep paralysis individuals are aware of their surroundings but unable to move or speak, often experiencing frightening sensations. Sleep bruxism individuals are typically unaware of the grinding or clenching during sleep as it occurs unconsciously. 12. Emotional effects. Sleep paralysis can cause feeling of fear, anxiety, or panic during the episode. Sleep bruxism may occur frustration or stress due to physical discomfort and dental issues. 13. Treatment methods. Sleep paralysis managed by improving sleep hygiene, stress reduction, and sometimes medications if linked to other disorders. Sleep bruxism managed with dental appliances, management techniques, and sometimes medications to relax jaw muscles. 14. Long-term effects. Sleep paralysis generally not harmful but can cause significant anxiety or disruption in sleep if frequent. Sleep bruxism can lead to long-term dental problems including tooth wear, gum damage, and jaw pain if not treated. 15. Awareness during episode. Sleep paralysis individuals are typically fully aware of their surroundings and the paralysis but are unable to move or speak. Sleep Bruxism, individuals are unaware of the bruxism during sleep and may only become aware through symptoms or dental examination. Thank you. Have a nice day.